Well, thank you for joining us today, Dr. Amjad. And we want to first talk about shingles. So what exactly is shingles? Shingles is a virus that we can get really at any age, but it tends to get into the nerve roots and causes a lot of pain, and most people are familiar with the rash of shingles. And what causes shingles, or how can you get shingles? It's a virus, so usually you might get it from someone who's not had chickenpox before. That used to be the old school thing, but people who've had chickenpox, because it's in the same family, still get shingles. So you get it by either breathing it in from someone who's had it, or we also don't know how some people just catch it.
And they're said to be extremely painful, right?
Yes. Because it gets into the nerve root, it causes a lot of pain. And a lot of people come in initially complaining of like a weird sensation of pain on a certain body part. The rash might not be present, but they have just severe pain even to touch. And that can happen before the rash, so we try to get it before. But what happens is if it gets untreated within 72 hours, you can avoid that pain with the shingles. But if not, it tends to settle in the nerve root and causes the person a lot of pain.
And what is the best way to avoid shingles, if there's even a way to avoid shingles?
That's kind of hard because we've had patients who have had chickenpox and you think they're immune. We've had patients who've had shingles and get it again. The best advice is that if someone has shingles is to stay away from anyone who hasn't had anything like that because you can transmit it to them. So that's the best advice. If you have it, to stay away from other people so you don't give it to them.
How effective is the shingles vaccine?
It's pretty effective. So there's two there now. Zostavax is the old one. The newest one that they've come out with is called Shingrix, which you need 2 shots. They're about 90% effective, I would say, but I've had patients in my office who've had the vaccine and still got shingles. It's just not as painful and as prominent, so it kind of cuts down, kind of like the flu vaccine.
Okay. All right. Well, thank you. And now we have a viewer question, and today it comes from Michael Bakari, and he wants to know about when you stay hot all the time, and is it actually good to continually use your air conditioner all the time?
Well, thanks, Mike, for the question. So it just depends. So if you're hot all the time and you need to be cool, I mean, staying in an air-conditioned place is helpful. I don't think it's harmful. But if you're someone who's always sweating and is always hot, maybe there's some other instance. Maybe you're not drinking enough fluids, but there's no harm in staying in an air-conditioned place.
And you mentioned fluids. Is there any way, or what is the importance of drinking water even when you're not exercising? Like, could that help cut down on, I guess, how hot you're feeling?
Yeah, definitely. So we sweat water, or that's water that's coming out. So the more water you drink, the more hydrated you are. So you should be able to burn off that heat more. But you do want to make sure you drink enough water, especially if you're very hot, even if you're not exercising. It's very important.
All right. Well, thank you so much for joining us, Dr. Amjad.
Thanks.
Ask the Doc is brought to you by these community-minded sponsors.
Have questions for the doc? We'll just visit our website, wvnstv.com/askthedoc. We'll ask Dr. Amjad your question, and be sure to tune in here on 59 News at 10 every Thursday night to see if your questions were answered. Well, coming up,